From your childhood, from when you were 12, with your masters who are herb and plant specialists, and coming to Britain and being the first doctor to open up studying in universities, I feel like you're quite a herb and plant specialist yourself. So it was an honour today to ask you the following question.
Thank you.
If you could describe to us the power of herbs, plants, tastes, and how that works within the context of Chinese medicine herbs.
Yeah.
Nowadays, in Chinese, Encyclopedia of Chinese Medicine, herb medicine, as a country, from a country, is about 11 or 12,000 herbs together. So therefore, it's increasing a lot. And we're still increasing because as we know more about plants and more about earth, so more things that we discovered.
Yeah.
Just like science, other things. The medicine expanding. And also, there are more study about Chinese herbs. You can do research in a chemical way, what is the chemical components, or you can research other ways, say even, for the nutrients way to see what nutrients it contains, like calcium, zinc or whatever, and or even the research, some medicine where they can have an antibacterial effect or even virus. In 2015, probably many people know, one of the very famous Chinese herbs called Artemisia has been studied treating malaria successfully and become one of the best treatment for malaria now that's in the world, better than traditional drugs. So that study has sort of been accepted by the world and they win the Nobel Prize. The way we see the herbs, the way we use the herbs, especially as a Chinese doctor like me, is still very different from the many so-called Western scientific point of view. Because as a scientific point of view, they want to study these herbs, if they can use for infection, or that herbs can have maybe iron for help blood supply or nourish the blood, anemia, or that herbs can help something else. So that's their way. People are born differently, people behave differently, people eating differently, so therefore their body are different. So somebody will call them hot, somebody will call them cold, somebody will call them damp, somebody will call them dry. We use it to balance the body. So we divide herbs or 5 categories. So we say there's herbs are very hot, there's herbs very less hot, there's herbs very cold, there's herbs less cold. And then if this is 4 category, or in the 5 category, there's herbs neutral in the middle. So middle, not too hot, not too cold. So this one in the middle. So all the plants, according to Chinese medicine theory from ancient to now, is from this way to classify them into a group. So, and for example, the most neutral ones are food. Okay, for example, rice, let's say apple, peach, all these things are mostly neutral ones. And then less neutral ones, we call them maybe, let's say spice, let's say ginger, let's say, or even chili, hot, even other hot, like echinacea, very hot. So this, we divide them. And cooling, for example, let's say melon are cooling, or watermelon, or cucumber are cooling. So those, we divide food, we can call them food and herbs, because medicine and the food, there's never have any clear line, this is food, that's medicine in ancient China. Because food is a medicine, medicine is food. And that is why the Chinese diet is based on this. Because we don't believe this is a food, nothing to do with medicine. No. Medicine is food. Food is a medicine. Because they're just simply a different degree of hot and cold. Look good, smell good, taste good, but the most important one is good for your body. Now, what do you mean by good for the body? Of course, everyone will say, oh, this food have a nutrient, have a protein. No. Good for you, because every individual are different.
Yes.
So that's why sometimes people say, when they give people advice for food, they say, why don't you print out, piece of paper or read a book about what is good for people? I say, no, because everyone is different. I cannot give this paper for universal to everybody.
Yes.
They are different. As you know, some people in the winter can wear a t-shirt.
Yes.
Somebody
so
in the
true.
summer
That is so true.
have to wear a jumper.
Yeah.
Why they have different for the temperature, for the cold or hot feeling? They're different.
Yes.
So sour, sweet, pungent, bitter, salt. Yeah.
Yeah.
So this all. So each of the tastes have a different function. So that's why the food. That's how the medicine classified further.
And also the results are with the patient. So if they come to you and their problem is solved by the plants, then there's
that's one thing.
Yeah,
that's one thing. It doesn't matter what I say. So
Yeah.
these things, people still, the critics still say, well, you talk something which is just like you talk about philosophy or something, and we're talking about medicine. Medicine is not philosophy. Medicine is science. Is a black and white. Is evidence based. The people argue. What do you say? That's pure nonsense. I said, well, no, it's not nonsense. I said, we want to see the result.
Yeah.
Okay. The bottom line is, if you're a doctor, the bottom line, you're treating the people won't get better.
Yeah.
If you come in for skin condition, at the end of the day, you won't get the skin better. And not only one better for 1 week, you want better for a long time.